Hello, I'm Diane. Welcome to Primrose Hospice. I'm going to take you on a little tour, try and demystify what a hospice is all about. Right, welcome to our day hospice lounge for the patients. We can take up to 15 patients a day and it's very much designed as a group support, somewhere you can come and talk to your nurse, somewhere you can access all our services and facilities from. Primrose Hospice is open to anybody with a life-limiting disease. When you're first referred to Primrose, you'll have an initial assessment with one of our clinical nurse specialists. And what we're looking at is what are your initial priorities. For some people, it's dealing with the initial diagnosis, management of their symptoms, pain relief. It can be concerns about the people who are going to be caring for them. Primarily, we are patient-led. We will help you in how you want to be treated, where you want to be treated and when you want to be treated. The services we have here at Primrose include volunteer support, a physiotherapist and an occupational therapist, so you can access these services whilst you're here in the day hospice. Some of our volunteers and our therapy assistant will run activities here. You're not forced to join in them, it's completely whether you want to or not. So it'll be things like quizzes, physical activities, jigsaws, puzzles, crafting, all available to you here in the day hospice. One of the facilities we're most proud of here at Primrose is our grounds, our gardens, all maintained by volunteers, but it's a nice space for patients to come and sit with their carers, with their nurse, with other patients. Nice peaceful place. A lot of our patients can't manage to get outside at home, but they can come here and do just that. Right, whilst at the hospice, you are entitled to have a 2-course meal. We have cooks on site Tuesday to Friday, so everything is freshly and locally sourced and prepared on site. We can cater for your dietary needs, and also if you prefer a lighter option rather than a full 2-course meal, we can cater for that as well. Welcome to our spiritual space, also known as the Octagon because it's 8-sided. We do have a chaplain and a chaplaincy team who support us all week, usually in the mornings. We're non-denominational, it's here if you want to use it, or otherwise the chaplaincy team are quite happy just to sit and chat with you if that's what you prefer. We quite often use this space as reflection, meditation, just a quiet space to come and sit if needs be. But we will also run services, memorials, and most recently we've run a wedding blessing for somebody who was unlikely to make their relative's wedding here at the Octagon. This is the most recent addition to Primrose. It was built in 2014 with a grant. It's our garden room. Opens out onto the garden. We can bifold the doors back when we've got the really nice weather. And we use this for a lot of the wellbeing services that we run. And also it's another place to come and sit if you want somewhere slightly quieter than sitting in the day hospice lounge. One of the things many of our patients worry about when they get their diagnosis is how their loved ones are going to cope. Our support services at Hospice Centre are centred around counselling, benefits advice for you, which will cover everything from will making to blue badges, accessing benefits that you may now be entitled to. We also have a range of complementary therapies here that you can access, so that's everything from Reiki healing, acupuncture, aromatherapy, massage and reflexology. We have based here our family support service, so we will help with children from the ages of 6 up to 18, both pre-bereavement and post-bereavement. We have a small team of support workers who are trained in children's psychology, and they will support you and your children before and after any bereavement. Well, thank you for joining me on the tour around Primrose Hospice. I hope it's gone some way to demystify what a hospice is and what it does, and the services it can offer you and your family.